This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. It's thought around 34% of people with Covid-19 in the UK come from a black, Asian or ethnic minority background. Those are communities that make up 14% of the population in England and Wales. The government's already announced it's investigating why. Now Labour's launching a rival review headed by Baroness Doreen Lawrence. Meanwhile, doctors have also been looking into it, and I'm joined now by infectious disease physician Manish Pareek. Dr Pareek, I understand that one of the difficulties in looking at this is that until recently, no one's actually been recording the ethnic backgrounds of Covid-19 victims.
That's right. So we've been concerned at a clinical level in seeing different ethnic minorities presenting to hospital with COVID-19, often with quite severe disease, but also the reports in the press and in the media generally about healthcare workers and black and minority ethnic groups having seemingly a higher death rate. So we tried to understand what was the actual data out there. So we've looked in terms of surveillance data and also published literature, and there is very little at the moment, which is looking at ethnicity and COVID. And I think that's one of the biggest issues. Because of the lack of data, we can't be clear what the relationship is yet.
And yet, there does appear to be one.
In terms of the published literature, both in terms of the publications, but also surveillance databases, certainly from the US and possibly also from the UK, because they've started to report that in the last few days, there does appear to be an increased risk in certain ethnic minority groups. Now, I don't want to alarm, and that's important for everyone to realize, that further research is required to understand what that increased risk is and why is it there. But there does appear to be that certain ethnic groups are at a slightly increased risk of having adverse outcomes. And I guess the more serious concern, or certainly in the press, is the healthcare workers who seem to be disproportionately from black and minority ethnic groups.
Which then begs the question, why?
So I suspect that this is a multi-dimensional and multifactorial thing. There is, if we consider people getting infected, firstly, if your risk of getting infection is likely to be a mixture of your environment, your genetics, but also who you live with and how you socialize. And all of those things may well differ between ethnic minorities and the white Caucasian population. But then if you do get COVID-19, the second question is, if you're infected, are you at higher risk of getting more severe disease and sadly also dying? And that, I think, then also we need to think about comorbidity. So by that I mean diabetes mellitus, hypertension, other conditions which would make you at higher risk of having poorer outcomes. Per se, we don't yet know that, and I think what that really requires is first data to be collected on all of those factors, but also then to try and understand which of those factors is key in driving the more serious adverse outcomes.
Now, the government's tasked NHS England with looking at the issue, which the Chief Medical Officer says is absolutely critical. Labour say their review is different because they're talking to representative groups. The lawyer and activist Dr Shola Mos-Shogbamimu is with me over Skype. Do we really need two investigations?
Absolutely, yes. Look, I'm not going to mince my words. I'm glad that a review is being done, but I have zero confidence in the government that gave us the hostile environment, gave us the Windrush scandal, and the government that weaponized Brexit against immigrants, Black, Asian, and ethnic minorities to do the right thing by any formal review into the high death toll of Black, Asians, and ethnic minorities from coronavirus. In fact, I believe it was Dominic Raab in one of his press briefings that said, well, COVID-19 does not discriminate. And if that's the starting point, if he does not understand that there's a discriminatory impact of COVID-19, and that's the underlying basis of their formal review, I am glad the Labour Party is undertaking its own review. It's absolutely important for there to be checks and balances in this. It's important for there to be transparency and accountability.
So we have these two reviews ongoing, and we know that doctors are looking at this issue as well. Why do you think BAME communities are being so badly hit by this virus?
The long-standing structural inequalities faced by Black, Asian, and ethnic minority groups directly exacerbates their exposure to this virus. So you're not getting the virus, for instance, from your culture. You're not getting the virus from whatever other physiological, biological reasons people want to put out there, or say that, some people are actually saying that, oh, people from the BAME communities are not fit, they don't eat healthy. That is not why people are getting the virus. They get the virus from exposure to it. And what the pandemic, I think, has effectively done is to magnify long-standing structural inequalities that we've been talking about for zillion years. We've been saying, look, this is a problem. And when you then put that in the context of the high number of Black, Asian, and ethnic minority deaths, it shows you that essentially a lot of the key essential work being done in the United Kingdom are underpinned and serviced by Black, Asian, and ethnic minorities, whether it's food, transport, healthcare, social care. These are the people who are going out there on the front line, who are not, being protected. They're being exposed to the virus. Socioeconomic disadvantages, what it basically does is it places ethnic minorities at a higher likelihood of poverty, higher likelihood of temporary jobs, insecure jobs, and low-paid jobs. Okay, all of these things contribute to health inequality.
So we have these reviews going on. They'll eventually release their findings, but does something need to be done right now?
Without a doubt, immediately, while they're trying to understand what is going on, this lack of PPE is not only disastrous for everyone on the front line, but clearly it's most disastrous for those from the BAME community. All the people that are out there working on the front line, many of them are genuinely scared. They are selfless in sacrificing and risking their lives. But we cannot put them on the front line without giving them a chance to survive.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.